first few months with a baby are supposed to be a happy time for new moms, but the symptoms and stigma of postpartum depression can make it miserable, sometimes bad enough for hospitalization. We're here to shed light on the disorder is Dr. Samantha Meltzer-Brody from UNC. Good morning, doctor.
Good morning. Thanks for having me.
Of course, it's nice to have you on. So we're tackling a very serious subject this morning, but some people listening and watching may not be aware of what it is. So could you describe postpartum depression to us?
Yeah, I'm really pleased to be here to be able to shed awareness on postpartum depression. May is Maternal Mental Health Month, and postpartum depression is one of the most common complications of childbirth. It affects 1 in 8 mothers who give birth, and it's associated with potentially devastating consequences to the mother and her family.
So what are those signs and symptoms that people should really be looking out for?
So postpartum depression can present with both mood and anxiety symptoms. Women can feel sad. They may feel overwhelmed by taking care of the baby. They may not want to be around the baby. They may be having difficulty with normal functioning. It's very different than the baby blues. So the baby blues is much more mild. It lasts a short period of time. In contrast, postpartum depression is serious. It impairs functioning. It impairs the mother's ability to take care of her baby. And that's why it's so important that women get treatment. At its worst, women with postpartum depression can have suicidal thoughts. And in fact, that's one of the greatest causes of maternal mortality. So this is really something that warrants anyone suffering with it to reach out and get help.
Yeah, well, those are some, devastating figures and facts that you shared, and, it's really sad that mothers have to deal with this sometimes. Luckily, though, there are resources out there for them to be able to turn to, including something called the Hummingbird Study. Can you explain what that is?
Yeah, the Hummingbird Study is a new study that's investigating a medication, an investigational medication called brexanolone for the treatment of postpartum depression. I'm at the University of North Carolina at Chapel Hill, and we've been involved in the study. I'm the lead investigator since the beginning. It is a study where women across the United States who are eligible would come in for a 3-day stay, treatment with the medication, and then they're followed for a little more than 30 days afterwards and carefully monitored. Women can seek care at one of the sites around the country, and the hummingbbirdstudy.com is the website, which has great information about eligibility, about details, also great information about postpartum depression in general.
Okay, excellent. Well, that's a great potential program that people could be a part of. But besides that, are there already treatments available for postpartum depression?
Yes, there are treatments including a variety of different medications and psychotherapy that are used to treat postpartum depression, but there remains a great unmet need for new treatments that would be effective for almost all women that suffer with postpartum depression. That's why we're doing this study. That's why we're excited about the Hummingbird trial, and we're really encouraging women during Maternal Mental Health Month who are suffering with postpartum depression to talk to their doctor, to talk to their family, to make sure they get treatment, and to consider the Hummingbird trial as an option. The Hummingbbirdstudy.com is the website, and as someone who's taken care of women with postpartum depression for more than 20 years, we are very committed to making sure that women speak out, that a disorder that has a lot of stigma is removed, and that mothers get the help they need.
Absolutely. Well, Dr. Meltzer-Brody, thank you so much for your attention to this matter and for everything you do for it.
Well, thanks for the opportunity to talk today.
Absolutely. Now, guys, stay right where you are. Morning Blend will be right back.